Hi, in this video we're going to be talking about Abilify or aripiprazole. My name is Dr. Beluja, and this is basically phytube.com, and this is from Neurology and Developmental Medicine at Kennedy Krieger Institute and Johns Hopkins University. This video does not replace your healthcare provider in any way, and this is in conjunction with Johns Hopkins Medicine and the Kennedy Krieger Institute. This video is also brought to you by www.kkimeds.com, and the portal is phytube.com. The uses of Abilify are acute and maintenance treatment of schizophrenia, bipolar disorder, and major depressive disorder. How does it work? Well, it's really unknown. The proposed action is that it's mediated through a combination of agonist activity, meaning activity that stimulates dopamine and serotonin receptors. These are neurotransmitters within the brain, and basically dopamine causes an increased amount of excitability, and serotonin also modulates different kinds of moods, and basically this is where the proposed mechanism of action is. It's also thought to be active at the acetylcholine receptor, causing some side effects such as increased acetylcholine, and we'll get such as increased acetylcholine would, and we'll talk about this. It causes a clinical worsening of depression and suicide risk. So if you feel down on this medication, you should call your doctor immediately. It also causes a syndrome called neuroleptic malignant syndrome, and this is where you get stiff, increased amount of fever, any sort of signs of increased sweating or no sweating, increased stiffness, fever, heart palpitations, sort of the sympathetic or overdrive type syndrome. Please call your doctor and call 911 immediately. It also causes tardive dyskinesia, which is sort of the slowness of movement. Any slowing of movements, anything that you feel like is a little bit out of the norm for you, please call your physician immediately. Causes hyperglycemia, and symptoms of hyperglycemia are increased palpitations, sweating, all of this perspiration. Same thing, call your doctor. Orthostatic hypotension is a place where basically you feel like you have a decreased amount of basically strength, stature. You stand up and you feel a lot really dizzy, so you should really call your physician for that. It also causes leukopenia and agranulocytosis. So if your physician does feel like you're getting too many infections, it can cause some blood problems and problems in the immune system. Abilify is also known to increase your seizure risk, and it's also known to cause some problems with swallowing. So if you have any pain on swallowing or anything like that, please contact your physician. Other side effects are nausea, vomiting, constipation, headache, dizziness, akathisia, meaning you're sort of unable to sit still in your chair, anxiety, and it also causes insomnia. Drug interactions. So Abilify interacts with bromocriptine, prazosin, diltiazem, hydrochlorothiazide, levodopa, and drugs affecting other liver enzymes such as ketoconazole, quinidine, carbamazepine, and fluoxetine. It also increases seizure risk when taken with drugs such as bupropion, INH, which is used for different kinds of infections. The most common kind of infection that INH, of course, is used for is tuberculosis. It is also used with thioridazine, theophylline, tramadol, and tricyclic antidepressants. So if you're on any of these, you should really understand that there's an interaction. So this comes to the end of our video. Thank you so much for watching phytube.com, an affiliate of Johns Hopkins Hospital and the Kennedy Krieger Institute.